Hi, everybody. My name is Dean Rocco. I am an attorney here in Los Angeles with Wilson Elser. For the moment, until our planned moderator, Doug Esposito, can join us, I will jump in and act as the moderator. We are doing a program today which is titled Bringing People Back to Work. And we're going to talk about some of the things to think about as you're returning your employees to work under this new COVID universe and paradigm that we're living in. In addition to myself, we're joined today by Dee Dee Kennedy from Benesis Health Insurance Services. Dee Dee's a benefit specialist, and she'll be providing her perspectives from that universe. Jeff David from Call & Jensen's an attorney. He's going to be sharing some employment law and benefit perspectives. And Nicole LeMay from Mammoth Distribution, who's a pro of pro in the HR world, and she'll be providing our real-world HR perspective. That being said, with the introduction, I hear Doug may have joined us by phone. So, Doug, I'm going to turn it back over to you. I've provided everybody an introduction of who's on the line here, and maybe we could just jump into a discussion about pandemic preparedness plans.
Dean, can you hear me?
I can hear you, Doug. Go ahead.
Oh, fantastic. So sorry, everybody, for the technical difficulties. So we definitely have a lot to cover today. The topics that we're going to be breaking down, and thank you so much, Dean, for stepping in, will be pandemic preparedness. The next section will be work site safety, leave management, and support of employees' mental health. So we're going to have about 10 to 12 minutes for each topic, and so there's plenty to start with. So we've already made introductions. Why don't we just kick it off, and we'll start with pandemic preparedness. Jeff, just from the top, I mean, what are some priorities should an employer have in preparing for another shutdown?
Well, I think that the employer should have a couple things in mind, but the baseline should be that they need to have a plan in place. There's a chance that we shut down again as a result of COVID-19, but I think that employers should also have a plan moving forward, because there's a reasonable chance that something else happens and another shutdown is necessary for another reason, or another virus emerges from somewhere. So this is a concern that employers should have moving forward as a plan. Priorities that an employer should have in preparing for another shutdown, be it for COVID-19 or another reason, include really clarifying work from home plans. Who you want to identify what employees can work from home, who can or who can't, what the limitations are, what kind of technology you have or what technology you wish you had in place to enable work from home. You want to make sure that you have a system in place for checking out equipment, if that's the way that you want to go. If employees are going to be taking computers, for example, home from the workplace, you want to have an easy to roll out process, because in an emergency type situation, which it's possible we'll be in, you don't want a situation where people aren't sure what to do or people are lined up. You want something that's very easy and quick to implement. Finally, I'd add that this is a minor thing, but something that I've counseled a lot of clients on at this point already, is that you want to be able to be prepared to account for business expense reimbursements. That's sort of an automatic thing. If you are shifting to a work from home situation, then the safest course for business expense reimbursements is to set an automatic reimbursement level for things like cell phones and internet, because those are what's being used from work from home, and the law requires that employees be reimbursed for reasonable business expenses. So for example, my own employer now pays a set sum that goes towards a portion of my internet bill, because I'm forced to work from home and constantly using my internet. That's a small thing that can get lost in the shift to work from home, especially in an emergency situation. that it helps to have included in your initial preparedness plan so you don't miss things like that that could incur liability down the line.
Got it. Hey, thanks, Jeff. Dean, anything else to add as far as, aspects to consider with the pandemic preparedness?
Well, I guess what I would just generally say, I know we've had a program earlier in the year about some of the nuts and bolts of putting pandemic preparedness plans together, but I would say really don't just create one and then sit it down and ignore it. The guidance has really changed over the course of the last 6 months as our understanding of the virus has changed. So I would say continue to look to the CDC and OSHA at a federal level to see what their guidance is, and then adjust your plan or your program accordingly. Here in the state of California, a similar thing has happened. When this first thing broke, we had the city of Los Angeles closing at the same time that the state was closing, and the local Department of Health with the state Department of Health almost competing with each other in terms of what they wanted to be done. We've really seen some alignment there from the state level down. So go back and look at the state's blueprint for a safer economy to see what their guidance is for an industry or a particular type of workplace. Go to the State Department of Health and look at their employer playbook to see if they've got anything there that's new or developed into something that's a little bit different than what it might have been provided when you put your plan together, and then continue to monitor your local county and county Department of Health to see what they're asking you to be doing, and then obviously just don't just take that stuff in a vacuum. Walk through your actual day-to-day operations, see what people are actually doing, and put those plans into action. And then the last thing I would say is don't just do that and put it into a drawer somewhere or a folder somewhere. You actually have to talk with your employees and monitor it to make sure they're following it.
No, that's a great point, Dean. Something sitting on the shelf doesn't really help much unless it really becomes part of the organization. Nicole, with that kind of lead-in, how have you communicated, your plan at Mammoth to the team, management, employees, that sort of thing, and how's that been?
So it's really important, I think, when it comes to communication to choose multiple vehicles to do it through. And I think we're going to touch a little bit more on this later, but, understanding what resonates best with your team and how they're going to hear it. So whether it's having something that's written that they can read and understand, but also having meetings where you're walking them through it and explaining the reasons behind why you're making those changes and making sure they understand them, posting it, sharing it with via a PowerPoint, having those Zoom meetings where you can bring people together and talk them through all of it and explain, especially if you're just bringing people back to work for the first time, explain to them what it's going to be like, what to expect from the moment they step foot in the door throughout their day. So it's really walking them through what that employee experience is going to be so they know what to expect. We've been through so much rapid change during the past 6 months. At this point, our appetite for change is really, really low to nil. And so I think the more you prepare people and say, this is what it's going to look like. You're going to arrive. You're going to have your temperature taken. You're going to check in with this person. You'll have PPE issued to you. You'll see markers that tell you to stay 6 feet apart, or if you've got plexiglass set up, you'll let them know that they can do that and include the visuals that you can, if you've got photos that you can show them, so they know ahead of time and that visual impression is there. So as they walk in, they know what to expect, and it makes it easier for them when they come on board. And then I think the other piece of that that's really important when you're communicating is making sure that it's two ways. So surveying them, getting their feedback anonymously of what they're concerned about, what they're worried about, what might be working. If you're already there, what's working, what's not working, so that you can address those and go in and course correct when you need to.
No, got it. I mean, there is definitely no shortage of things that take up time and energy, with pandemics or any kind of disaster kind of recovery. But I really appreciate that angle, too, because it's got to be one of the most valuable assets, obviously, are our employees, and really checking with them and making sure that they're comfortable and they're not concerned. I mean, it's got to be huge and pay off in a safer, more productive environment. Hey guys, don't forget, if you have questions, go to my webinar platform, and there's the question box in the menu bar, and definitely send those questions to Justin, and he will disseminate them, because we're going to have probably 15 minutes for Q&A by the time we're done. Okie doke. And then as far as the preparedness, I mean, Dee Dee, anything else, from you that you'd like to add, in addition to Jeff, Dean, and Nicole?
For sure. Clearly, any plan needs to include a section on testing and making sure that the employer is able to demonstrate that they've got good practices, and that if something should arise, that they're testing appropriately. And being in the benefits world, there's a lot of questions I'm fielding related to when insurance pays and when it doesn't, and things like that. So it's like driving a car. This whole pandemic and everything that we're doing is driving a car while it's being built around us. Everything is changing kind of daily. And I would say, in relation to what coverage there is for testing, again, we're shifting, and it's almost as if there's no absolute single rule to use. Each of the insurance companies are interpreting it differently. We have had 2 carriers in the last 3 weeks come forward saying that they are not going to cover testing in a preventive sense. There is zero question, and they will always cover based on the CARES Act and other interpretations. They're always going to cover when there is an exposure to symptoms, when there are symptoms present, when it's medically necessary. That's the standard that they're looking for. The question becomes, well, we're trying to maintain and demonstrate that we're doing everything possible in our workplace. And so we want regular testing, even when there aren't those factors, when it's not clearly based on exposure or symptoms present. And so that opens up a range of interpretation with the carriers. So my first piece of feedback is, make sure you talk to your insurance broker about what your specific carrier calls for, and make sure that it plugs into what your desires and expectations are. There's a variety of phenomena going on out there that are kind of, I wanted to talk for a moment about balance billing. When a test is covered by insurance, that's supposed to be the coverage in its entirety. The providers are prohibited from billing any fees on top of that. And again, doing some what's called balance billing. And from a personal perspective, we had a test with my son, and we received from the local hospital, a very credible provider in our community, we received a specimen handling fee of $100. And we called, said, what's this? They put us on hold, immediately wrote it off, took it off the account, came back on the line, said that they had done that. And when probing, saying, well, why are you even charging it? It clearly states that coverage, it's supposed to be covered at 100%. And there was no good answer brought forward for that. And they got off the line really as quickly as they could, which tells me that there was knowledge. And whether it's in an evolving way, or whether at that time that was their philosophy to see how many fees they could receive, it just was a difficult thing. So, it's great for you to let your employees know that balance billing is prohibited. There are no frequency limits. And I've got my dog saying, let me out. Sorry, I let her out before this happened, and here we are. So no frequency limits, stop. And there are a wide variety of services jumping off for employers to use, where there is an app and tracking symptoms, and then they'll even come out and do testing on the work site. They'll send somebody out, in addition to potentially having a contract with a clinic for testing. Then there also are a series of mail order options. And again, work with your insurance company as to what's going to be covered. If it's out of network, then it potentially could be a cash pay on the part of the patient, and then they can file it for reimbursement during their plan. So I just wanted to kind of overlay the worksite safety with that discussion about coverage, because that can play into a program pretty distinctly. And with that, I'm going to let the dog out.
Perfect. Hey, thank you, Dee Dee. Dee Dee definitely obviously got into quite a bit of details, and so there's a lot of options out there and support, but it also dovetails nicely into our worksite safety category. But before we move on to that category, are there any questions that maybe someone wants to write in for a preparedness plan? Justin, have we seen anything out there? If not, I'm just going to move on. Okay, so let's talk about worksite safety. So when we're looking at like best practices, we've got a couple of categories. One is, if someone tests positive, an outbreak on the work site, exposure coming from an external source, and then also from traveling or large gatherings. But why don't we start with on the work site? Dean, what is required when an employee has been on site and test positive for COVID?
Sure. This is one of those places where the guidance has changed over the last couple of months. And I would say, generally speaking, you're going to want to take the CDC approach on when an individual can be around others after testing positive or being exposed. We'll talk about an exposure without a positive test result in a second. But generally speaking, the response to somebody who has tested positive and is a COVID-19 positive patient has gone away from any sort of a response that would allow an individual to test negative for COVID and come back. It's almost purely now a symptom-driven approach. If an individual has been with symptoms for at least 10 days and their fever has gone away for at least 24 hours without consideration of any sort of fever-reducing medications, and those symptoms are no longer persisting and they're improving, with the exception of things like taste and smell, which there's anecdotal evidence of those lasting for weeks, if not longer. So, the fever, the fatigue, those other sort of symptoms, if those are improving, it's been 24 hours since they've had a fever, and it's been 10 days since those symptoms first appeared, those sort of workers can come back. In the interim, they need to be sent away from work. And that's where, to Jeff's point earlier about sort of looking at your leave, remote working policies and some of that other stuff, all of that needs to be plugged in with that employee then to encourage them to stay away from work, get treatment. If they can still work in telework, great. If not, put them on leave and plug them into those sort of leave programs. If an individual never shows symptoms, the symptom test would allow them to come back to work 10 days after they tested positive, assuming that they don't develop symptoms. And the CDC guidance provides a little bit of bumpers around individuals that have really bad reactions or severe illnesses. Those are sort of treated on an ad hoc basis. Those people may need to stay out and be on isolation longer, as many as 20 days after their symptoms appeared, depending on how they react and their underlying health conditions impact their response to being COVID-19 positive.
Got it. Wow. I mean, the thing that stands out to me, Dean, is that, this is just something that really is changing, similar to what Dee Dee said, where we have to completely, monitor it and continue to look at what needs to be done, when and how.
Yeah, we'll talk about it in a minute.
Appreciate you.
Yeah, we'll talk in a minute about it, but it's going to get even more complicated for employers with the onset of some of the new bills that were just signed into law. So for folks on the line, please stay tuned, because it's no longer just the obligation to get them out of the workplace. Now there's going to be a lot of reporting and record keeping and things that they're going to need to do. So we'll talk about that in a second.
No, got it. So Nicole, I mean, so let's talk a little bit of money. I mean, who's responsible for paying for testing or following a worksite outbreak? Because, I mean, it seems like it's a gray area, but I don't know.
Well, I mean, I think from the law standpoint, it probably could be a gray area. That would be more of Dean's department. But I would say from a standpoint of doing the right thing, the employer should pay for it. It's really just a part of showing that care and compassion that you have for your employees, especially if you are an essential business and you've got people that have been on site that are working hard to keep you afloat and keep you moving forward. Paying for their testing is just absolutely about doing the right thing.
And Doug, I'm going to kind of interject there
Yes.
that when there are symptoms, when there's an outbreak, when there's an exposure, there's clear-cut insurance payment for that. So if you have an underlying medical plan offered to your employees, there should be coverage for that. It's when it's not deemed medically necessary, when it's purely preventive in its nature, that's where it becomes carrier by carrier distinctions.
Okay. Got it. Hey, can you guys hear me a little bit better now? I jumped off a headset, so I apologize if it's difficult to hear. Okay, so that's a little bit on, work site. Let's talk a little bit about exposures. I mean, Dean, what happens when an employee is exposed to COVID at work, but by a family member during more, risky activities like traveling or attending gatherings, et cetera? How does that change the game?
Yeah, this is another area where early on, people didn't know really what to do with folks. There was a lot of competing guidance. Again, we've normalized into a fairly clear standard. It's a symptom-based standard, an exposure-based standard. If people are exposed to a COVID-19 positive person, regardless of where they're exposed, they may need to isolate. Now, if it's somebody that's at their home, they almost certainly will be. If it's somebody at work, they might be. If they go to a particular state, there might be some other rules there. If they have somebody at home, they're probably going to meet the test for exposed to a COVID-19 positive person, which is being within 6 feet of someone for more than 15 minutes. If you have a particular worker, let's say you've got a warehouse and somebody's working up front and they test positive, and there's somebody that's doing deliveries that never is exposed to them or around them, that person doesn't need to worry about it. But if there's somebody that sits at the desk next to them, or that was working on a project with that person and they were around each other quite a bit, that workplace exposure may require you to then force that person that's not yet COVID-19 positive but's been exposed to go home from work as well. And again, those sort of people, you're going to need to plug them into your disability and leave management systems and state benefit programs, and encourage them to really stay away and make sure that they don't show symptoms. If they go to certain states, California doesn't really have this. In other states, if people go in and out of certain areas, they're required to stay home for certain periods of time. If that comes into play, obviously you'd want to layer that into this discussion. But if somebody's just exposed to somebody with COVID-19, staying home is going to generally have to last for 14 days post that exposure. Now, there's new guidance that just came out. If an individual has tested positive for COVID and they've recovered fully from that exposure within the last 3 months, they don't need to then isolate. So if I contract COVID-19, I recover, I'm no longer showing symptoms, I don't test positive for it, and my wife or my child is positive for COVID, the fact that I have somebody that's sick at home doesn't require me to isolate and stay home from work. I can still come and go from work. So it's a new little wrinkle just to keep in mind.
Got it. It sounds like it also entails having a lot of honesty, and having employees that can, that were willing to communicate with you. I mean, Nicole, how would you set it up with Mammoth to try and handle some of those delicate conversations?
Yeah, and your point is right. Honesty is really critical. Transparency is really critical. And, in any organization, when it comes to those two things, it obviously starts at the top with your leadership team, showing the ropes to everybody and really setting that template and setting the example. But also having those policies and explaining to your employees that you're asking for transparency, you're asking for them to be truthful about where they get exposed or where they travel to, so that you can make the right decisions to protect your workforce. And if there's times when they violate that, then you've got to figure out what the right and of course legal disciplinary action is that you're going to take in regards to it, because you have that duty of protection to the rest of your workforce. So if they aren't being truthful, then there does need to be some kind of consequence and some system in place so that you can manage that, because otherwise one person starts to be untruthful and then before you know it, it could snowball into a bunch of people for it. So you definitely have to hold people accountable for that, and that's really staying on top of it, having that, asking for that honesty and that transparency and demonstrating it consistently across the board.
Got it. No, I mean, that kind of brings me up too. I mean, what are the ramifications? I guess this is more of a Dean question or a Jeff question, but what are the legalities, about, discovering what employees are doing through social media, because that's a great place where you can see really what people are doing, which could be really increasing your exposure. But Dean, Jeff, what are your thoughts on that piece?
I guess I would just first say that you need to proceed with some level of caution when you're using things that you're getting from social media or your own computer systems. If there's something that's publicly available, or you're getting unsolicited reports from staff, hey, so-and-so's husband's sick, you can and should take action on that. But to dig into people's social media or require them to give you access to their accounts or try to get into somebody's personal email through their computer at work is going to get you in trouble with an invasion of privacy claim.
Yeah, and building off of what Dean just said, if there are employees, there are rumors, that's one thing. But as an employer, you cannot share the identity of any employee that you find out has tested positive for COVID or is sick. That you may think is somewhat in contradiction to, well, you need to warn other employees, and that's true. And so what the obligation that employers have is that while you can't share the identity, the employer does have an obligation to notify anyone who's been in close contact with that employee. And Dean mentioned the within 6 feet for more than 10 or 15 minutes. I advise to err on the side of caution in this, and if you think there's a chance then that a certain employee was exposed to someone who's been sick, who's been tested positive, then I would advise that employee. You don't want to play it too close to the vest and then turns out someone was exposed. There's an obligation here that employers owe to their employees, both legal and moral, as Nicole mentioned earlier. And that means casting a wide net for potential exposure of any employee who may have shared a space with the employee who's tested positive. You can share that. So if an employee has tested positive, the employer can share that an employee's tested positive, that you have been in close contact with that employee, and you can share when that employee tested positive. That the when of the positive test is helpful in terms of knowing what the risk actually is. Finally, Dean mentioned this, and I think there's some foreshadowing here, but in terms of that privacy concern, Dean's going to address some reporting requirements in the case of an outbreak, which has a specific definition, and you have to notify the public health department. And in those cases, employers are obligated to share the names of the employees who have gotten sick, but that's separate and apart from the workplace. So there's not a contradiction there.
Got it.
Hey, Doug, can I add one other thing? Doug, I think when it comes to these situations, which they're definitely sensitive, it's how you talk about it with the employee that really can help. obviously you're going to hear or maybe see inadvertently something on social media or hear from another team member. But I think if you address it with the employee of, maybe not necessarily referencing that, but saying, I've heard some things. We know how much you care about your colleagues. We know you're committed to keeping this workplace safe, just as we are. Let's have an honest, transparent conversation about this and work through it. And I think sometimes those can boost those conversations to get people to come forward, but sometimes it takes a little bit of massaging to get there.
No, that makes a lot of sense, but I could definitely see the value in this, without a doubt, Nicole, and your culture is going to be huge with that. But yeah, no, that's thank you for sharing, thank you for interjecting. So refusing to return to work, I mean, what happens? I mean, if you've got an employee, they're quarantined, but then they don't want to come back to work for whatever the reason. I mean, what are our options there? Jeff, for instance, maybe from a legal standpoint, even if they have a doctor's note, how does that work?
This is a tough one. A lot of employers are finding that employees, for a multitude of reasons, are hesitant to come back to work. That may be because it turns out they're really comfortable working from home. That may be because they think they're at high risk. That may be because they have a family member who's at a high risk. Each of those reasons is separate and in the eyes of the law has a different consequence. Most important thing, starting with the easiest one, is that the guidance from the EEOC and other authorities is that there is no entitlement to a leave of absence to avoid exposing a high-risk family member or a member of the household. So if that is the reason an employee is hesitant to want to return to work, of course, as Nicole is talking about, there's an important communication aspect to this. But from a legal standpoint, there's no obligation to put them on leave for that reason. Now, if the employee themselves believes they're at high risk, that's when the employer is obligated to begin what's known as the interactive process to determine what the risk is and how it can be accommodated. This is where interactions with the healthcare provider really come in, because an employee may think they're high risk. There may be a lot of information out there about what it means to be high risk, but to be high risk actually has a very specific definition under the EEOC guidelines that comes from the CDC. And the CDC has identified a very specific list of conditions that would designate someone as high risk and therefore require accommodation as a result of COVID. I'm not going to go through that entire list, but some of the conditions on that list include chronic lung disease or a serious heart condition. And if that's the case, then the employer is going to have an obligation to accommodate that condition. Getting to the point where you identify that condition, though, can be part of the process. There are employers who actually are able to speak directly to employees' healthcare providers to work as a part of the interactive process to determine what exactly the condition is. The employers need to be careful about requesting too much private information about what the condition is, but I have prepared for my clients specific questionnaires for employees, healthcare providers, to say, does the condition that you've identified in the employee fall under this list provided by the CDC? And the overwhelming priority behind all of this is that in California, when an employee can work with a reasonable accommodation other than a leave of absence, then the employer can't require the leave of absence. So there are situations where, in the reverse, when an employee might want an accommodation that the employer doesn't want to necessarily give or otherwise will stay home, you can't enforce a stay-home requirement unless no other accommodation is possible. It becomes complicated, and these things need to be looked at on a case-by-case basis. But these are definitely the important considerations for when an employee is refusing to return to work, asking why, and engaging in the interactive process and making sure that you as an employer are fulfilling your legal obligations to the employee.
No, without a doubt, it does sound complicated, nuanced, and case by case for sure. Thanks, Jeff. Why don't we jump to leave management? And leave management has a lot in here, but Dee Dee, super quick, why don't you just hit the highlights of what are the various benefits in a handbook for leave management, and then we'll let Dean jump in about what some of the federal and state acts are requiring.
One of the key things related to disability leaves, medical leave, personal leave, is to make sure that your handbook has sections on when do employee benefits start, when do they end, who's paying for them at what period of time, and what those due dates are, and to make sure that those are syncing with your insurance company's contracts. So we just wanted to start this segment with a quick thing of don't forget who's paying for insurance. Nicole, I think at this point I'm going to hand it off to you.
Yeah, I mean, I think the most important thing, and any HR person will tell you, that's been the biggest joy of all of our lives for this is tracking all of this person by person as we've gone through it, and as the leaves have changed, and then not only this new law, but then there's also a bunch of other leave laws that were already in existence out there. So comparing them side by side, okay, when do these come into play? So whatever methodology you're going to use, whether it's your HRIS has some kind of robust program that does it, or if you've created some kind of manual program, it's important to be on top of that, because what you don't want to do is find yourself in a position where you've given too much leave, and then all of a sudden you feel like, oh, okay, I have to do this for all these other people because you've set this precedent. So it's super critical to just be tracking it and staying on top of it and making sure you know how to track all the different leaves in case they all start to come into play or start to cross and mingle. So you have that documentation of that leave, and you've tracked it, and you're also documenting from the employee side, letting them know here's what's available to you, here's what you're getting, and so that they have something that's very clear from their end that can't be confused should you ever come to a situation later where someone says, oh, you didn't provide my leave. You know, we always say he who has the most documentation wins, and this is that critical area as an HR person where you've got to stay on top of it and make sure you're managing that.
Got it. The HR is a huge piece of puzzle in this whole COVID world, for sure. Hey, Dean, why don't you pick up, because we're moving a little bit long on time, but if you could, what's the summary of the federal and state benefits, and especially the new requirements that are going to be affecting us also too first of the year?
Sure. So what Nicole was just describing is only going to become more difficult in the coming weeks and months. I shouldn't even say coming, because some of this stuff's already immediate effect statutes, and employers should already be doing some of the stuff. But many of the folks on the webinar will be familiar with what the federal response to this was, and the Families First Corona Response Act, and the emergency sick leave and family leave that was made available through that enactment for employers with less than 500 employees. But just generally speaking, the Act provides emergency sick leave of up to 2 weeks for individuals if they're quarantined or under medical orders to quarantine or isolate because of a COVID-19 related medical issue, or because they need to care for a child whose schools or daycares closed because of COVID-19 related issues. And there's an additional 10 weeks of paid emergency family medical leave for individuals who need that additional amount of time to care for a child who's been sent home because of school or daycare closures. There's a bunch of requirements on those. We could spend a half an hour on them, but I'll just leave those there. And if you haven't already worked those into your medical leave programs, you should be doing that. At a state level here, we already have state unemployment and disability leave programs that are plugged in and are available for individuals who can't work or have been laid off or furloughed because of COVID-related issues. And effective as of, I think it was the 17th of September, a couple weeks ago, we now have a California paid sick leave entitlement for employers with 500 or more. So larger employers that before didn't have to provide those benefits will need to do that. The other thing that's come along here, and I'll just sort of jump ahead and grab something that I think we were planning on talking about later and capture it now, Doug, is the California Family Rights Act has been around for a number of years, and it previously only applied to employers of 50 or more employees. Certain parts of it were expanded to employers of 25 employees or more. Now the entire California Family Rights Act has been expanded and will go down to employers of 5 or more employees as of January 1, 2021. So if individuals have medical leave, medical issues themselves, or they have family members with medical issues themselves, they're going to have leave rights up to 12 weeks of unpaid leave to tend to those needs without losing their job. So as we move through the fall and into the winter and look to turn the corner on the year, undoubtedly COVID's still going to be something that we're dealing with, and that's an additional thing that we're going to need to be layering into the analysis here and tracking whether or not somebody's eligible for a leave, and if they're taking it, are we not only giving them the paid time off, are we not only giving them the ability to take time off under our other policies, but are we tracking that time under the California Family Rights Act? And I would add there that for those of you that are watching this that are saying, well, we already have a program, we're fine, we don't need to amend anything because we have 50 or more employees and we were already building this into our systems, just realize that the amendments to the California Family Rights Act also expanded the type of family members that can qualify for this sort of leave, step children, grandparents, and grandchildren. So you may find yourself needing to offer CFR leave to an additional and expanded group of employees in situations than you would have otherwise had to, even if you were already dealing with this statute.
Whew. Man, got it. Hey, Jeff, Nicole, anything maybe that you just want to add or layer in or put an extra exclamation point to what Dean said?
I think Dean captured everything, but I would say, just like we said before, this tracking is critically important, and really knowing which leave law to apply is going to be critically important as we continue to evolve through this.
And I would just add two glosses to what Dean and Nicole have said. One, on the tracking point, the new COVID supplemental paid sick leave that Dean mentioned, with limited application to employers of 500 or more. But for those employers it does apply to, it requires that the new sick leave be tracked on pay stubs. So employers who fall under this requirement need to make sure, and it went into effect September 9th, need to make sure that they're listing that sick leave on their pay stubs immediately, which can be complicated, as we all know, for anyone who's ever worked with a payroll provider. I'd also add that employers should remember that their obligations extend beyond the set 12 weeks available in CFRA and FMLA, because the California Fair Employment and Housing Act obligates employers to accommodate, not never ending, but for a period of time that's a lot more indeterminate than the 12 weeks. So it may actually be a longer accommodation period than what's expressed in some of these other statutes.
Thanks, Jeff. Okay, so let's pivot to some other rules, regulations. I mean, Dean, SB Senate Bill 1159. This is closer to my heart.
Yeah, so this is a beast, and I'll try to avoid legalese and try to synthesize this for folks, but this is going to require a major change in the way that you respond to COVID-19 arising in your workplaces. And if you have workplace exposures, it's no longer just going to be simply a matter of getting people off work and getting them plugged into disability or leave rights and programs, but also there's going to be some things you're going to need to do in the workplace and reporting. So everybody recalls a couple of months ago, Governor Newsom issuing a rebuttable presumption for individuals who contracted COVID-19 within a certain number of days of being at work. SB 1159 just sort of codified that and made it the law. But that sort of presumption really only exists through July 5, 2020. From that date forward and going forward, the new presumption is going to be that if an individual tests positive within 14 days of performing work at their place of employment, it will be presumed to be work-related if there's an outbreak going on. And an outbreak is defined as a couple different things. If you're a larger employer, you've got 100 employees or more at your location, the total number of employees that have to be testing positive before an outbreak's triggered is 4% of your workforce. If you're a smaller employer, you've got less than 100 employees, the minute you hit 4 employees testing positive, regardless of where it was, but if they test positive, you have an outbreak, and these are now all going to be presumed to be work-related. Also, if you happen to be in a location, everybody recalls the Springfield meat packing facility where it was ordered shut. If you have a real bad situation, a public health department orders you to close because of COVID-related issues, that's going to be considered to be an outbreak as well. So if that sort of stuff's going on, anybody who tests positive that's working for you within 14 days of that occurring is going to be presumed to have contracted the virus at work, and it's going to be deemed to be a compensable injury unless you can rebut it. The only way you can do that is to show that you took measures to reduce potential exposure or transmission in the workplace, or you can show that the employee had a risk to exposure outside of work. So all the stuff that we talked about a couple months ago when we talked about return to work planning, some of the stuff that Jeff and others mentioned earlier on today about sort of, again, going back and looking at what you're doing and really bringing your pandemic preparedness planning to life, that stuff is going to be critically important if you're trying to rebut the presumption that somebody got a workplace exposure. From the date that you learn of this sort of an outbreak, employers have 45 days to gather and submit evidence to rebut that presumption, or it's going to be presumed to be a compensable injury. So it's a very short window of time to act. I mentioned the reporting requirements. When you know or should know of an employee testing positive for COVID-19, you need to report that to your claims administrator for work comp purposes within 3 days. And when you do that, you have to tell the administrator, we have an employee that tested positive, here's the date of the positive test, and here's where the employee worked during the 14 days prior to the test. And here's the highest number of employees that reported to that same work site in the 45 days preceding their last day of work there. So it's not going to be an obligation on you, but the workers' comp carriers are all having to figure out how they handle all that data and information. You should not be providing the name of the employee that tested positive to your work comp administrator unless there's already been a workers' compensation claim filed. So those reporting requirements include cases that are known about between the July 6th cutoff date of that old presumption and the date that the statute was enacted, September 17th, and it'll continue to go forward. And you have 30 days to report that information for those older cases. I should also mention that in addition to 1159, we also just had AB 685 passed. That will become effective January 1, 2021. And similarly, as you receive notice of potential exposures to COVID-19 at the workplace, you're going to have to provide written notification to all employees and employers of subcontracted employees of those exposures. You're going to have to do some disinfection and safety planning, and you're going to have to provide potentially exposed employees with information about COVID-19 related benefits to which they might be entitled. At that point in January of next year, you're also going to have to start notifying public health agencies when there are outbreaks. And outbreaks in that context are even defined a little bit more differently and a little bit more refined. An outbreak there would be 3 or more lab confirmed cases during a 2-week or a 14-day period. So you're going to have to start not only notifying workers' comp carriers, now we're notifying departments of public health. So a lot to digest there. Just be aware that this is happening. If it's not already part of what you're doing, work it in. And then if you have counsel or you have questions, reach out to counsel and make sure that you get it all ironed out so you're doing it the right way. And don't find yourself getting hit with a claim for failing to comply with that law.
Wow, that was a lot, Dean. You know, and everybody on the call, I mean, I think the biggest takeaway there is listen, there's no way to avoid this, meaning the compliance, the information, the reporting. There's just not. And I hate to say it, but embrace it, because from everything we see, COVID's not going anywhere anytime soon. So you're going to have to play this game. And when it flows into the workers' comp, you're just looking at another insurance tax that is going to further, flow along with you, causing higher premiums. But hey, reach out to your brokers, reach out to your labor law folks, and really don't let this fall by the wayside. Definitely. Okay, so time check. I think we've got about 5 minutes left, and this seems to always happen, but this is definitely not. This is one of the more important aspects, but it's subtle. And this last category, and I'm almost ashamed we don't have as much time as I'd like to devote to it, but supportive employees from a mental health standpoint during this pandemic. It's tricky, but Nicole, what are you seeing in your org? And I'd really love for you and Dee Dee to really weigh in on this about what's going on and the changes and what you can do to help.
Yeah, I really want Dee Dee to talk a lot about this because she has some great information, but I just want to say 2 really key important things. One is, first and foremost, as you know, whether you're a manager, whether you're HR, whatever your role might be in the organization, when it comes to mental health, it's very, very important to remember, unless you are licensed, there are very specific boundaries and things that you want to be extremely careful of when it comes to this. If you're licensed, great, that's one thing. But if you're not licensed, we can't make diagnosis. We don't have that information or those tools to do that. However, what we can do is be those extra eyes and ears. And as managers and as HR people, it's critically important that we are, when we see something that seems off, or an employee it just doesn't seem like themselves, or they're acting very differently or reacting very differently. We can identify that there could be something going on. It might be that they're just having a bad day, but there might be actually something really serious going on that they could use help from. And when you do recognize that, I always keep going back to communication because it's so critically important. But having that discussion of, hey, let me give you some resources and tools that can help you if you're struggling with something right now. And I know Dee Dee can talk a little bit more about what those are that are available, but making sure that you're communicating and connecting that employee with those resources is a great thing to do and important in our roles as HR and as managers.
Absolutely. And I would just kind of lift from there that we're in a mental health epidemic in the United States. We had it before COVID, and it just ramped up the acuity of it. We're seeing a monster spike in the number of suicide attempts, the number of suicides. April over April. So April of this year, the number of calls going into the suicide awareness line nationally went up by 1,000%. We are absolutely seeing the trauma of COVID play out in many, many different ways. And to put it through the lens and to focus the lens on cannabis, I would just say that I would anticipate that our people love the plant. They love being in the industry for a lot of different reasons. And part of that is because they love the plant. And we know that frequently there's very effective use of cannabis for depression and anxiety. So let's kind of know that, know thyself, get an idea of who your people are, and just kind of anticipate that even if you didn't see it previously, we're going to see an increase of it going forward. And traumas take years to unfold. They absolutely do. So having a specific training program for your leadership, for your supervisors, to know what to look for. You know, what are the symptoms of anxiety and depression? Is it overwhelm? Is it an inability to find words? That a level of articulateness that used to be there has now diminished. I mean, these are stressors, stress-induced kinds of things. So learn about, you know, what to listen for. A scenario I had a number of months ago was an employee didn't finish their enrollment, and I was watching my account management, and they were CCing me on this. I was watching my account managers saying, we're able to apply for an exception if you'd like to get your medical insurance. And I did a direct appeal to this gal, and I said, you know, are you sure that you don't want us to help out here? We think we can get you through, but and it took asking twice. And what she came back to me is I'm so depressed, all I can manage is getting to the to the store and then going home. And so I really encourage all of us to kind of listen with our hearts, to listen with the ears that are listening for this, because it's going to be cropping up all around us, and we can really make a difference in somebody's life. And we were able in that scenario to have a referral into the EAP. The EAP counselor called her since she was having difficulty moving forward with a lot of things. We had got her permission to go ahead and do that. And again, we were able to get her into coverage, and the EAP, they're the professionals, right? There's that boundary between what's the employer's role and what's the what's not. But it comes from training on active listening, knowing what the symptoms are, and then knowing what the response is, how to approach it in a way that's an ally, in a way that is makes it an emotionally safe environment. And there are benefits in medical plans for mental health. There's always kind of some bumps in the road in accessing care in certain circumstances, but I highly recommend you work with your insurance professionals on meeting criteria, medical necessity, utilization review. There's a wide variety of things that I do feel as though your insurance folk can be very strong advocates to connect with care. And I would also say that many of the medical plans out there, even if you don't have a direct contract with an employee assistance program or don't have an EAP benefit that's attached to your long-term disability or your life insurance, many of the medical plans have opened up their EAPs and have brought forth a variety of resources. I know Kaiser, for instance, has a subscription to Calm, which is a wonderful meditation and sleep help, and a couple of other kinds of things. Sandvello is one. Again, these are the kinds of things that insurance companies are really trying to push out, knowing that this is a growing problem and that those resources are needed, whether that's directly contracted or not. Again,
Dee,
I just...
Hey,
yeah.
real quick, Dee, real quick, EAP. What is EAP?
Thank you. Employee assistance program, they tend to be external vendors, if you will, that are staffed by clinicians who have a given level of expertise. And it is a support system for employees on a myriad of fronts. It can be mental health, it can be legal problems, it can be if somebody is experiencing severe financial difficulties because someone's been laid off in the family unit. It can be elder care issues. It can be the critical incident kinds of things like domestic violence and, to put a real circumstance, we have a distribution client where one of their drivers was held up, and the driver at the time was a woman, and she had a gun to her head, and it was really traumatic. Any employee would have a reaction to that. And bottom line, it provides the employer an ability to put those licensed clinicians who know exactly how to respond to critical incidents, respond to appeals for help, and they can provide a lot of that training of the supervisors on what to look for, what to say, and then how to refer in. Did I get it, Doug?
Dee Dee, thank you. Dee Dee, thank you. That is awesome. I mean, you guys, we are right at the 1 hour mark. We're at 1:02. But if I can wrap it up for the teams, thank you for everyone for participating. We've got Dee Dee Kennedy, as you just heard last, with Benassist Health Insurance, Dean Rocco with Wilson Elser, Jeff David with Colin Jensen, and Nicole LeMay with Mammoth Distribution. It's so complex out there. You must rely on your professionals, rely on your attorneys and your brokers and other folks in the cannabis community. And if you have questions, definitely email us individually. Justin can also help too, and reach out to the CCIA. There's tons of info out there. Just raise your hand and ask for a little guidance, and I guarantee you'll get it. Okay, anything else, Justin? He must be on mute. I wonder if I'm on mute.
We got you.
Can
Doug,
anybody
you're good.
We can hear you there.
We can hear you, bud.
Okay. Well, is Justin still there? Are we all good?
I think we could just sign off.
Okay, Justin. Can we all? No. Just I got Dean on the phone. What's going on? Okay. So, Dean, I think we're done. I think we can just hang up.
Sounds good. Thank you, everybody.
Thanks,
Good
everyone.
talking with you.
Okay.
Thank you.
See everyone.
Bye-bye.
Apparently, Justin lost internet connection. So, okay, you guys, talk later. Bye.
Take care.